Welcome to AIM Agenda. These are our top stories. We begin with the current situation on the coronavirus crisis. The Morrison Government's extended the travel ban to Italy. The European nation is under a nationwide lockdown. People entering Australia via Italy will be blocked from doing so, the fourth country on the border ban list alongside China, Iran and South Korea. The Prime Minister's announced $2.4 billion in emergency health funding as he warns Australia's health system will come under great stress. More than 116,000 people have been infected globally and 4,090 deaths recorded. The Australian death toll remains at 3. There are 116 cases in Australia, including 6 new infections confirmed in New South Wales. More than half of those 100 cases have fully recovered and the majority are considered mild. New South Wales has 61 cases, Victoria 21 and Queensland 18. We begin our coverage this hour with the Prime Minister's $2.4 billion plan to help protect against the outbreak. Joining us live is political reporter Trudy McIntosh. Trudy, take us through the details.
Annalise, it was a very substantial package that the Prime Minister and Health Minister just announced there, $2.4 billion, but it has dozens of elements within it in terms of dealing with the health side of this coronavirus outbreak. I'll take you through the details as we know them. The first being that up to 100 pop-up clinics will be put in place right across the country, able to test up to 75 people a day. There will also be free video GP consultations via Skype, but this will only apply, it's been confirmed, to people who have coronavirus or they appear to be vulnerable to this. So it won't just be to anyone who doesn't have symptoms. Third, there will be a home medicine service. So this is $25 million so that prescriptions can now be filled remotely or also done online. Fourth, we'll see this national triage phone line, $50 million here. You'll be able to call up now, providing 24-hour advice to see if you need to go to a place to be checked for coronavirus. A boost to remote and regional screenings. There had been a lot of concern that Indigenous communities in particular will be hard hit by this virus. A boost to funding here so they will now be able to test people coming in and out of these areas. Also, we'll see a bulk build pathology testing. This is to increase the test for coronavirus. $100 million going towards aged care. That's not only to educate staff in this area, but to help fund additional staff where needed. $30 million towards the vaccine research. $1.1 billion. This is one of the biggest centrepieces of this for the medical stockpile, including increasing things like masks, but also access to antibiotics across Australia. And then finally, this $30 million national ad campaign. It's quite a significant package we've seen announced today by the Prime Minister. He is stressing that the health system is under a great period of stress at the moment, but that everything's being put in place to make sure they'll get through this crisis.
These will not be usual times and usual demands on our health system. And so I anticipate there will be times where that will come under great stress. That is not a reason for alarm or concern, because a plan and the resource and the preparedness and the professionalism of our health system will attend to those needs.
There has been significant confusion amongst the Australian population about who should be tested if you have a flu-like symptoms or a cough. Should you be going to get a coronavirus test? Well, the clarification today from the Chief Medical Officer is no, unless you have had contact with someone who's been overseas or been overseas yourself in the last 14 days, you shouldn't be rushing out to get a test. Here was his information.
There is no point being tested at the moment if you have not travelled or if you've not been in contact, even if you have flu-like illnesses. But other Australians do not need testing, and all they are doing is putting an unnecessary burden on the testing.
And Trudy, the Prime Minister's changed the travel advice for Italy as well.
Annalise, despite a few days ago the Prime Minister saying and stating the difficulties there would be in extending this travel ban to Italy, today he says on the advice of border authorities that they will be doing so. Here was his advice.
Effectively, though, I think it's important not to overstate this. I mean, Italy itself has effectively put itself into lockdown with travel now, and this largely closes that loop. We already had the enhanced screening measures that are in place. This, of course, will mean that any Australians, residents or others who are obviously exempt from those travel bans.
So this $2.4 billion announced today, the Prime Minister also revealing tomorrow we will be getting this bigger economic stimulus response, Annalise, to help businesses to get through this time.
Trudy, thank you.